Oftentimes patients think of chemotherapy as their enemy when actually it's their ally. If you were taking an antibiotic because you had a urinary tract infection or a cold, you wouldn't be thinking negatively about that pill that you're taking, and yet you would know that it's killing some cells in your body that's doing you harm. Chemotherapy is doing the same thing. It's actually destroying cells that otherwise would be doing you harm. So it is your friend, and you should view it as your friend. Before you start any chemotherapy regimen, talk with your medical oncologist about some of the preventative healthcare issues that need to be addressed. For example, I'm sure your doctor will say, go to your dentist if you haven't seen your dentist within the last 6 months. So if there's any dental work that needs to be done, it can be done prior to chemotherapy beginning. If it's flu shot time, it's time to get a flu shot. Even if you haven't ever had shingles, and you are 60 years and older, your oncologist also will probably recommend that you get a shingle shot. In looking at a chemotherapy regimen, it can look a bit daunting, but if you record it on a calendar, you can very much simplify it. You want to make sure that you have transportation for the days that you're going to be receiving your therapy. You also will be going back more than likely for some blood work, so you want to record those specific dates and times on your calendar. And there will be certain days that you will be at higher risk for developing an infection because your blood counts will be low. Your doctor or his nurse practitioner will inform you specifically of what those days are, so you can create your own chemotherapy calendar.